This podcast is brought to you by Penji. Penji is a creative subscription service that gives you access to pre-vetted, agency-trained creatives from all over the world. From graphic design to illustrations to social media management and web development, it's all included for one monthly price. It's time to say goodbye to the hassle of searching for top-notch creative talent. With Penji, you get quality and consistency delivered right to your inbox every day, carefully crafted for you by humans. So meet your new creative team today. Head over to penji.co for more and enter the coupon code located within the podcast show notes.
Alrighty, hello everyone, and welcome to the Fully Managed podcast where we discuss marketing and business tips to help assist you on your business journey. I'm your host, Shannon, Penji's partnership coordinator, and I'm joined here today with a very special guest, Jeremy Pagel from Innovative Media Solutions Group. Thank you so much for joining me today.
Thank you for having me. I appreciate you.
I appreciate you. So, could you start by telling us a little bit about yourself, maybe introduce yourself in a different way than I would if you have some preference, and explain anything about yourself that you think would be relevant for your professional career that other people would want to know?
Yeah. So like you put it, you pronunciated my name correctly as well. You're awesome. You rock. So I'm Jeremy Pagel. I am founder and owner of Innovative Media Solutions LLC here in Grand Forks, Dakota, which is my hometown. As of late, it's pretty cool. I mean, I've been in digital marketing since Tom gave birth to MySpace. So I've been doing this for a while. I started out promoting local bands when I was in middle school, high school, the hardcore scene back in the day. And that kind of grew into a love of, well, how can we get more people to, see the talent or see what you got going on? And then I kind of attributed that success that I had with promoting just local bands, and it kind of just grew and grew and grew, and I've been doing this ever since. So right now is an interesting time and a really cool period for my company because we're doing kind of a rebranding shift right now. We're really into the healthcare marketing space. I've been working with healthcare facilities, providers for a long time, whether that was, dentist or orthodontist, primary care physicians, chiropractors, senior living facilities, that sort of thing. What's been really important is speaking engagements. I've been getting invited to a lot of speaking engagements, podcasts like this, which is awesome because more people should hear and know about, HIPAA compliance, which is a huge topic at the center focus of what I am doing right now. So currently I'm building a couple different softwares that will be going on to market for HIPAA and for healthcare specifically. And then, just educating and teaching people, ethical AI implementation, and was invited to, by the VOBC, was invited to the Grand Forks Air Force Base here to speak on boots to business, to exiting military personnel to help with their startups, to have that transition be a little easier, or being invited to the University of North Dakota's marketing club, spoke with about 45 to 50 students there about marketing and business and what AI means, in this day and age. And so making that transition, this is a very nice place to be. My grandfather was the first physiatrist in the state of North Dakota and helped build. And he he helped build the first physical rehabilitation center in Grand Forks, which is now owned by, I believe, Altru. Yeah. So, HIPAA compliance and patient. I mean, he was the kind of guy who would defend when the elderly people had their, Medicaid, Medicare claims fought against, by insurance companies. He was the type of doctor to show up in the courtroom. His accolades would speak for himself, so we are a people, I'm a solopreneur. I'm just out here kind of being like it's the wild, wild west right now. And data security and protecting patient information is extremely important. So that's kind of been the central focus as of late. Besides that, I've been doing SEO for around a decade, and, contribute where I can there. And I can keep going and going, but you can definitely transition me away from talking about myself. Talking about myself.
Well, I'll comment on a couple things. I think that first, ethical AI is something that I really love to talk about. One, because I think that philosophy is something that I can talk about better than the technological aspects of AI because I
Mm.
am not well versed in technology as we discussed before this call. Uh, but one, I think it's topical because of the entire the healthcare CEO thing. But I also think that it's nice to know that someone like you is spreading awareness for these specific things because I think that a lot of people see this AI as in like a new shiny object and they want to incorporate it in as many things as they can because they hear that it's easier and it helps and it does like all these different tasks that all so many different healthcare industries are underfunded, don't have enough staff, whatever it may be. This is such a great thing to implement, but then there's very horrible things that could come out of it where people might actually have a good outlook on, oh, this might do something good, but it
Mm.
actually does something very, very detrimental to a population.
Yeah. And that's it's great that you bring that up too, because most often, in my experience, 15 some years in digital marketing, and then the last few years really, um, I was speaking on telehealth, telecommunications. Before, just like I was working remotely before, it was like the cool thing to talk about or do. Uh, it gets overlooked because so many, especially in the healthcare sector, especially in the United States, right? Um, it's profits over people. It's what can save money, what's quick and efficient, and people look at AI as this all-in-one solution when really you're not understanding what server that's being hosted on. You're not understanding where that data is being transmitted. And then, lastly, you're implementing it simply to save money rather than how do we increase the quality of patients' care. And, I'm in Grand Forks, North Dakota, right? So there's a lot of rural areas around here. And I was on another podcast with Jeff Carlton, and we talked about this because, you know, farmer so and so or whoever out in rural North Dakota, they can't always make it to a doctor appointment. They can't always make it to a medication refill appointment. So these things are important to have in place. However, that healthcare provider needs to make sure that HIPAA compliance is being followed not only by them, but also by the marketing company, which is why I do HIPAA compliance marketing audits. So I'll audit your current marketing company and check for HIPAA compliance with one of my proprietary softwares that I've literally been in my office here at home coding by myself. And yeah, so you're right. They look at it as a very all-in-one solution. It'll streamline, whether that's like a chatbot, to help answer FAQs on the homepage, or whether that's a telecommunication, aspect to a healthcare provider's, realm in which they exist. It's just you gotta be following that HIPAA compliance, and when you're outsourcing and to save money, again, it's usually what it comes down to in marketing is saving money and how can we get the most bang for our buck rather than, hey, let's invest. Let's make sure that we're compliant, we're not leaking data, and we're not implementing something we don't fully understand just to save money. Because not every country has HIPAA, and a lot of outsourcing happens to, and while they may have other rules and regulations, it's not the same as what is going on in the United States. So yeah, there's a lot of horror stories when it comes to that. And that's the reason, HIPAA exists and federal and state regulations exist in the first place. So yeah, I appreciate you bringing that up.
Yeah, I think it's also this search for short-term solutions and not longevity. I think that again, AI being that new thing, a lot of people are like, "Oh my God, we have a problem right now. This would be perfect to implement in order to fix this," but they don't look at the big picture and see what this could impact in other ways. And I think that it's crucial in a field like that where these things need to be accounted for. Whereas if you're incorporating AI in an agency that is, just in a marketing agency and you don't work with the healthcare field, I mean, you're gonna figure out that a campaign doesn't work because you have something faulty in your programming or whatever it may be. And that's fine. I mean, that's not gonna like, unless you're working with small businesses in which that campaign was detrimental to their growth, um, you're gonna be okay. You can just pivot. Whereas there's the healthcare industry is something that's I don't know if more fragile is the word I'm looking for, but something that impacts people on a level where it's quality of life and death, possibly, if things are not done correctly. And I think that many agencies that may work with the healthcare industry don't see it like that.
Yeah, they don't really, and I've witnessed it. I mean, whether that's having, I I posted this on my YouTube channel, but of course, when you speak the truth or you say something that might not be, you know, I like going against the grain and speaking up for those that can't, right? So like people over profits. It's not I don't know, you've seen Matilda, the old Disney movie with
Mhm.
Danny DeVito when
One
he's
of my
pouring
favorites.
sawdust. Yeah, he's like Danny DeVito's pouring sawdust in car engines at the used car sales. Like
Mhm.
that's what I view old school marketing as, and that's because I've worked for companies like that, and I've seen some stuff. You
Yeah.
know,
No, I
and
get
it,
it.
and it, yeah, and it comes down to well, how come there's 20 people on the back end of this WordPress site from 4 different countries, um, that don't have HIPAA regulations, and why do they have access to patient forms that are being submitted on the back end of a website? And is that server compliant? Where is that being stored? And so data security, data privacy, that's where people should be focusing right now, because AI is learning off of all of us. And while we might not get the kickback commission, so to speak, that we want off of training all these models ourselves, uh, it's something to definitely be aware of and definitely look into. And you know, outsourcing or doing that kind of work. I don't outsource I do everything in house. Yeah, it might be a little more stressful, but I know I can trust my work and I know where everything is and where everything's being stored. And I don't have to worry about a data leak,
Like that.
or, yeah, it's stored securely in this room, that I'm in, uh, that has been designated the home office. So it's all very important. And with healthcare providers, there's negligence too. There's straight up cost savings. This will save money. Don't care about much else. Don't have the agreements in place contractually, or it's the old school marketing, profits over people rather than people over profits, how it should be, and especially in the healthcare sector.
What methods do you have to educate clients on these complexities? Like, I know that I'm sure a lot of them are coming from the place of saving money, and maybe when you suggest something, they might not be too happy to hear it. How do you kind of, maybe persuade them to implement some things in which you think are justifiable?
Well, look, I have no problem pissing people off, especially when it comes to HIPAA compliance and like, hey, you better make sure that that is being protected. I mean, there's such simple things that you can do. But how I educate is pretty much tell them, hey, look, I ran your site. I know that there are violations, and whether I can't really go into some of it just because some of it's the software that I'm creating.
Mhm.
So I don't want that out there yet, but there's ways to tell even without having a look at the back end of a site or anything, if there is HIPAA compliance being followed. So even that might even come down to reviews, providers listing a name or a family member's name, or, hey, so glad you came into our clinic today for your so and so and so. That's a HIPAA violation. You can't do that. And so I've caught myself having to explain things to doctors that I didn't think I'd have to explain to a doctor. So I come at it from a position of, this is like my family lineage, and like again, we put people over profit. So how I educate is literally telling them, hey, this is a violation. You know that. And the more serious violations, those go on the record. It's not something that just goes away. So educating is, the ways I educate is getting invited, places, speaking on podcasts like this to try to raise awareness. I can only do so much, but I'll do as much as I can to get the word out and to make sure that people know, hey, next time you're at your provider, like ask them if they're HIPAA compliant. Like ask them how their staff is trained. Staff training is another big one. I have something in the works for that as well, for helping to train staff on HIPAA compliance, because I've seen some pretty lackadaisical staff that, whether that's storing the data, how they store it, leaving a sheet out that has a check-in, like with names on it or something. All these things really, and I focus on the Midwest, like hardcore, right? Because that's where I'm from. I've lived in Minnesota, Wisconsin, North Dakota. I worked on campaigns in Iowa, Montana. Montana's a little out of the sphere, I think, for the Midwest, but
I'm horrible at geography, so if you told me that, I would have believed you.
well, for everyone else,
The worst subject, technology and geography.
Just gonna bring up all the ones that you're not so sure on and talk about those.
A bunch of states, and I'd be like, yeah, I mean, as long as it's not the one I'm in, because I know I'm not near there.
Well, and it's coming down to, look, I have been talking about this for a few years before other people were, unfortunately, because I think there's a lot of industry leaders that should have been. Instead, there was, people see AI and they see a gold rush, and they see they get the shine, like you said, the shiny object syndrome. They're like crows, and they're like, this and this and this, but
You have to get ahead of the game.
Yeah, get ahead of the game and sacrifice what? And that sacrifice what? They don't know, because no one's told them, or they don't understand it fully. So it's just really important that, that the word is out. And in the Midwest, I'm not letting them be left behind. There's a lot of area for growth, for room, and for help for other people. In the ruralness of the state is almost the same as, it's not geographically locked, right? Because inner city, you get like Minneapolis, they don't have resources to get places, or maybe a ride or something. So this whole AI rush really should be focused and centralized upon the fact that it can increase the quality of your patient's care if you keep their data secure. Number one, you're following federal and state regulations, as you should. And as a doctor, you should understand that. And number three, like, that's what you're there for, So I view all of this, and how I educate is literally just talking to people and letting them know. If it upsets them, whatever. I'm a little bit of not a little bit, I'm a market disruptor. So I'll call you on your shit, because what it comes down to is little Janie or Tommy or whoever's information being leaked. And it's because it's not just adults, it's kids' information, it's parents' information, it's grandpa, grandma, whoever. So really it's a huge problem, and HIPAA violations have been going up, statistically. So just getting the word out, not leaving the Midwest behind, because it's the Midwest. It's not Silicon Valley, it's not New York, it's not these bigger places. So as long as I can do my part in letting people know about the issue, talking about it, and then having my own softwares that I'm developing to catch people that are flagrantly or within their own negligence letting HIPAA violations happen, that's what I'm doing. I'll just call you and tell you. I really don't like pitching. I don't sell, is what I tell people, because I don't. You put people over profits. You focus on solutions, and you focus on how you can help somebody. Money will come. Focus on the money; it'll slip through your fingers, every single time. And at least that's one of the lessons that I've learned. And so, focusing on the people. That's really what most people are. Focusing on the people is what most people are missing out on. So it's just kind of it gets a little redundant, because it's like, yeah, put the people first, but what's that mean? And that means protecting their data, and that means being there for them, focusing on them rather than yourself and your bottom line.
You're also providing, I think, at that it is maybe a soft sell because you're providing value to these people that may like negligence is, they could have access to the information, but they don't. They choose not to or whatever it may be. And like that is unfortunate, but a very common thing. It's unfortunately common. But
Oh
it's
yeah.
you're providing not only this education for free and easily, whereas like, yeah, they could do that themselves, but they don't because either don't have the time, they don't want to, or there's cost saving solutions that may not be great ones,
Yep.
or people centered solutions. But I think that providing them value, being able to call them out on what they're doing wrong, is still a selling point because if you can do that and then also provide them with these services in order to do better, then it's like a no-brainer. I mean, I think that where someone would not is if they're just like a really good person.
You little have. Who said it? You said it, man.
It's just kind of incredible to even hear that people would say no to something like that. It
Yeah.
And I'm sure it happens, and that's scary.
Yeah. Well, yeah, and especially and it usually comes down to, yeah, cost savings, and then the fact that, working with the hundreds of different healthcare providers that I have over the years. I mean, one time I had worked for a company, I was managing 34 different accounts at once. That burned me out. There's a reason I made a transition to go into what I do now, but there's the hard sells, there's the soft sells, all this. But what it comes down to, I mean, I get like probably, I would say anywhere from like around 60 to 100, 120 cold pitches on LinkedIn every single week. I hate being pitched, not because I'm good at what I do, but because it's impersonal. It's usually rude. And so when I say I don't sell, I present that information and say, this is a solution. If that doesn't happen, I mean, there's regulatory committees, that need to be, spoken to in regards to HIPAA violations. So it's like, yeah, it is a no-brainer. And at the same time, why haven't you been doing this? And I mean, there's so many questions that get brought up after that. What have you been doing? Where have things been scored? Like,
if you're aware of it, then they're like, obviously you're actively seeking it, but I mean, like, there will be other people that will be aware of it at some point, if not immediately, because they should be doing that anyway. So it's like, why would you not use this solution when you're going to be in a great deal of trouble if you don't, at least down the line?
Yeah. And like, how do you want your community to view you? I mean, I am not above mentioning and talking about it, especially if people are going to a place. Like, I don't have an NDA with any of these. Like, that's the point at which I don't care. And when I say I don't care, it's when it's met with resistance and knowing that people could be harmed, or, you have these data leaks, and then where are people getting calls from when those data leaks happen? They're getting telemarketing calls. Elderly are being preyed on with robocalls, and so all this information being leaked has a huge effect. Like, the radius, it's like throwing a stone in a lake, and you see those ripples. It affects that community because, well, that healthcare provider is in that community and may have been in that community for 30 years, but it's going to ripple once that data is leaked. And with people not knowing everything they should before implementing AI or before building a website, or hiring the right marketing company that's going to be honest, I mean, that's another one of my points is my ideal client is anyone who's been screwed by marketing companies. That's my ideal client. I had spoken with a nonprofit actually the other day. Gave them some great terms, because it's in the community. It has to do with, the arts and stuff, and they're always defunded too, so I wanted to give back. And even after I pitched, whatever, the person was so hesitant and so not willing to give control up over the website, even though the website should be taken down and like redone, like that,
They're scared.
they were so scared by what had happened in the past, and I get that. So I'm here to kind of restore that name as much as I can while disrupting as much BS as I can as well, to regain that name of. I don't know if marketing ever had like a great name or vision in anyone's mind, but at least there's people like myself and a few other professionals I associate myself with that are out here trying to. Literally, I'm trying to make my grandfather proud. He's not around anymore, but I know he would definitely be proud in the fact that putting people over profits, and you're trying to raise awareness about something that is violated every single day, and that will have, bring people into the century that we're in right now. And that's, hey, let's care about people. I mean, is it like treat people with kindness and like care? And a lot of these healthcare providers too, they've made money off of you for a long time. So you know what? I'm here to say it's long overdue that you're following the rules. And again, I don't know why myself, a 33-year-old who has 15 years in digital marketing, needs to explain that to a licensed physician or ortho or whatever, but I'm here to do that. And at a certain point, the white coat doesn't mean anything to me. I need to talk to you business owner to business owner and make sure that you are following what you're supposed to follow, because that's my community. That's other people's families. And it really just comes down to that. Let's care about others, and let's get people affordable access to things while maintaining their dignity and their privacy. So
Yeah. No, the white coat does nothing for me. I've been to so many doctors. Ignored so many things. HIPAA compliance is the least of my worries. I would just hope that they would care enough about me to like investigate things sometimes. And that's baseline. Like,
yeah. And that brings it back to the AI shit, or AI. Sorry, you can cut that part. Yeah. That brings it back to the AI stuff. It's okay. Well, if you're saving money, if you implement it right, it's HIPAA compliant, you're saving money. Well, that money can be reinvested into your practice or reinvested into training for your staff, so they're not a deer in a headlight when it comes to how do I store this information or what am I supposed to do HIPAA compliance wise. I also give HIPAA compliance audit checklists. That's another way I do it. But if you're having all of that money saved and more time, then that means more time they can focus on someone like you who needs to maybe talk more, to get so that the physician has more time to listen, so it all comes down to, okay, let's save time, let's save money for sure. But then let's reinvest that time and that money into making sure that there are solutions in place for people who, number one, can't get to the clinic. So tele, right? Or the physician or whoever you're at healthcare provider wise. I work with some therapists as well too, mental health, which is another area, that's lacking, and just an access, so really all of this, if you have ethical AI implementation into your practice, regardless of healthcare niche, then you should be able to reinvest that time into listening more to your patients. I don't know the stats on it, so I won't say it, but I know it's not a lot. It's like in minutes, that a physician has to speak with someone, and how the heck are you going to write me prescriptions and know how things have affected me, what I've done if you have 3 minutes,
even then, I think it would be really lovely to have some sort of like AI implementation into searching for those things, because obviously not every, and every doctor is not well versed in your issues, like specifically, like it's impossible to have that much knowledge unless you have some kind of photographic memory to be able to, you know, like, yeah, maybe you're doing what they could do at home is Googling something, but like in a way that's more medically based, like if there was some kind of, I don't know, again, technology, not there. To be able to do that in a way that, like, that would be quicker and efficient, but but efficiency is what I'm looking for, and I think what most people are looking for, in the idea that, like, here's all these possible things, let's roll out all of the things that, like, are ruled out by, your general good health or whatever it may be, and then we can still isolate these possibilities, because there's so many things that, as a normal person, you don't think to look for. And like, that's why you're going to a doctor. Like, you can go on Google, like you can do that. That's fine. And you might terrify yourself because doctor Googling is the worst thing to do. When
Yeah.
you find out you have a brain tumor just because you have a headache. And
Yeah. Oh, yeah. Yeah. It's WebMD stuff. I mean, and that's what's crazy too, is there's so many opportunities, with like GPT vision, say, and it being able to detect fractures, green sticks, in X-rays a million times faster than a radiologist would,
that's incredible.
and so there's a lot of cool ways that AI can be used as long as information is protected. There's not a lackluster effort to protect it, and there's no negligence because information is so readily available nowadays. That's why, sometimes I have an issue with like professors or colleges, not just because I used to love being a class clown, but because, you know, there's no reason to not have access to that knowledge, and anyone who gatekeeps that needs to get out of the way because it's literally detrimental to a community, and it's detrimental to more areas than just healthcare. But that's where I happen to be focusing because it's just complex, I got to keep it interesting, got to switch it up. So, I mean, being able to educate and speak on it.
Honestly,
Yeah,
thank you for being the martyr of sorts for for the
it's probably
healthcare system.
it's probably a good term. It's probably a good term. Yeah, I love being able to, on LinkedIn, I'll call out bigger healthcare companies, and I'll tag them in my posts. I want responses. I know. I've stripped your site. I've literally run so many tests that I know, and so I'm tagging you because you know what? I'm not about the profits in any of this. As long as patients are protected, and if people cared more about that, I think the whole system would advance. So
Worry about yourself.
pray for them.
It's like a
No, it's perfect.
general question, but no, for sure. No, like, do you ever worry about your general safety because of doing that?
No, I don't
Martyr.
think anyone.
Martyr was
I mean, I didn't. If they don't have time to follow HIPAA compliance, they sure as hell don't have time to worry about me until I post an op-ed, or something. But I mean, it's those kind of tactics, like being a market disruptor, and for some reason, maybe I could have been I still could be a lawyer, I guess, but I love finding the little loopholes or the gaps in the market. I'm extremely good at that, and that's what these softwares that I'm bringing to the forefront first with HIPAA compliance in healthcare will help to start addressing, and hopefully give other innovators and creators ideas into how we can further that, so that not only providers being able to check in on their marketing companies, but then patients before submitting a form, being able to, hey, does this site have an SSL? Like, is there a reCAPTCHA? Is there just like basic security measures being used? But yeah, no, I mean, if I'm worried about my safety, nah. If they don't have time for their patients, and they don't have time to follow HIPAA, they don't have time to follow me. I would welcome any of them too, though, so they could like talk to me and just like say, like, hey, like, let's care about people instead of your, malpractice insurance rates and
Well,
your.
Well, if I can't reach you in a few months, I'm going to assume you're in witness protection and that you did something really crazy.
Really crazy good. Really crazy good.
Oh, yeah, no, that's the
Yeah.
important part. The really crazy good is important. But, yeah, no, I really do. Well, one, I commend you for doing this because I do align definitely with a lot of your views. I mean, I think you'd have to be, again, yeah, I'm gonna say it, horrible person in order to not. But that's just my opinion. But yeah, I do think that, but yeah, I commend you for doing this kind of work and for spreading this kind of awareness because I think it's really important, especially I'm sure that it's even like I'm in a hub of information in like on the East Coast. I'm in Pennsylvania. I'm in Philadelphia right now, but I I am not in the Midwest. I'm sure that it's even worse there. And even then, like being in a hub of information, it's still happening. And there's all of these problems in the healthcare industry. And to know about that. Very funny because I had no idea this was what we were going to talk about today.
Well,
This is what ended up happening. I mean, not that I had no idea. Of course, I had questions about it because it's something that's very heavily on your social media. But it is I'm happy to learn about it. So thank you, and also to know that someone's doing this because it's really, really important. So thank you.
you're welcome. I mean, is there any question that you wanted to ask?
So boring question left like you didn't breeze.
Okay.
I couldn't have expected to learn this this I'm stuttering because I don't have words. But I didn't expect to go so much depth on this topic, and I learned a lot. So thank you so much for providing this information because I don't usually get to talk about more unique topics. I started to talk a lot more about marketing, and I'm happy that I didn't because sometimes it's marketing,
It is. It's marketing. Marketing is marketing. But
and marketing is a marketing.
yeah. But I mean, I just appreciate the opportunity to talk about it and to, hopefully in the future be back on and we can talk more about
If you're not in witness
or
protection.
ads. Yeah, yes. Even if I am, I could throw a VPN on. It's
Yeah, the solution for all.
yes.
Well, thank you so much for joining me today. We were a little over time, but I had a great time, so I don't even care. So bye for joining me today. This was wonderful. This was fun and also really educational. I appreciated all the knowledge that you brought to the table. This is a unique topic that I got to learn about, and it's very exciting. So thank you for sharing.
Thank you for letting me talk so much about myself. And then
That's why we're here.
about it. Yeah, exactly. And then
We're not here to talk about me.
Well, I appreciate you for having guests on like me and actually listening and being able to push that out to more people because it is extremely important. And, just remember, like, I think Harry Styles or someone says it on SNL. I've been watching a lot of SNL, but like treat people with kindness, love each other and treat people with kindness. Like
If
comes down to
everyone did it in
caring
their
about
own,
people.
if everyone did it in their own corner of the world, like the world would be a better place. It's hard to do it on a grand scale and make this huge impact, but to be able to do it like just on a smaller scale and as much as possible is, I heavily believe in that.
You'll see the ripples.
Yeah,
Exactly. Start making waves.
Yeah. Well, thank you so much again, and thank you everyone for watching. Please don't forget to like and subscribe. See, hopefully more fantastic people like Jeremy. There's, I don't know if anyone's bad people. That's not me to judge if they're on the podcast. This was wonderful, and the agency world is very interesting, and I hope that there's more transparency and good to see in it. So thank you for being one of the good ones.
Thank you. I appreciate you so much, Shannon. Thank you.
Thank you. Have a lovely day, everyone.
You've been listening to Fully Managed, brought to you by Penji. Check out the show notes to learn more about today's guest, and to learn more about Penji, the human-first creative subscription service, head over to penji.co. And by the way, if you're still listening, it would mean the absolute world to us if you were to share this podcast with a friend and, of course, subscribe.